Oh, good. I do have a pen.
Those are good.
Lord.
Mm-hmm. I did not go. So I hope everybody, at least most of them are not born. So that no folks.
I bet they're used to that.
I just couldn't go to sleep.
I think that's quite normal. I think that's quite normal.
Yeah. I'm gonna be real busy tonight. I'm just gonna do things that get everything, together. And then we'll do things I've been putting off to make time go. Like do some ironing.
Well, I have some I can drop off. That's my favorite blouse that needs to be there. I don't need
But
it.
once I get started and after I get through, I feel as though I'll accomplish something.
They got any Starburst there?
Skittles. The tropical the best. And lots of chocolate. And one of each kind. Party.
See, I'm trying to keep them getting started and stuff like that.
Oh, I see. I see that.
Oh, really? Before we got here, because we were like mine.
Whoa.
Like you thought we'd come a little early.
Nope. Yeah, get your I got one of each. I did a lot of work on this. Go away, go away. Nope. Shoot. This is called an emergency. We got until 11 o'clock and that's it. But no more solid food for 2 weeks. Well, at least a
So
week.
11 o'clock is the end of when you eat, you start eating. 11 o'clock today?
No.
Tonight.
12 o'clock tonight.
Oh, is it 12? Oh, I thought it was 11. Okay, that's good. 12 o'clock.
Oh, you're talking about that.
That's cool. So I don't eat after 9 anyway.
I want some little potatoes.
Why is it?
Get a moment, I'm gonna make it.
I gotta find Lakes. I don't know where he is.
Really?
He disappears.
He's done that before. Oh.
He knows we're leaving. He's going somewhere strange.
So he senses that.
Sure.
I know. I was talking to Patches last night. That's me. Last time I'm sleeping with her. Oh man. I know they sleep around my body, and it's like just a big warm pillow, breathing pillow. I think it's so cool. Watch them breathe. They're alive, you know.
They probably like it for all.
You think so? Yeah, Latifah's gonna go down to the neighbor's house. She's gonna take me out to put him in the kennel. And I just have to call him every day.
You gonna call the kennel every day?
I have to comments so they can hear her voice.
Yep, as soon as I get out of surgery, I'm gonna get up, go to the phone. Bones in hand. They'll know. Tell it. Yep.
Well, with you, I am
Cave woman.
for anything.
What if your dogs get a hold of your bones and run around? It's like,
I thought about that, but my babies don't do that. They're not a regular kind of DOG. They don't even know they're DOGs. There's Mrs. Queen. Hello, Angel Wonder.
Good morning.
Good morning.
How are you guys doing?
Blessed.
Probably fall asleep next to Bob.
Fall asleep? Oh, like that. Just nervous.
Oh, give it back, Jen. Okay.
Okay.
Hi.
I'm Wanda. How are you?
I'm Jeff.
Jeff.
Good, how are
Great.
you?
Nice to meet you. I've met these three before.
Not me, girl. No.
I know you.
Oh.
Come on back. You're first. Back here.
Lois,
Okay, so
is she?
what are your
Put her on
appointments?
camera.
You little thing, you. Thank you.
Is she on camera?
Oh, see, you don't see that
Yeah,
voice until 10:50. You know
Right.
what? I'm gonna try if I get done with her pretty quickly because I've met with. Oh,
I
God
would like
bless
to get an
you.
introduction.
God,
I
I'm
am one.
gonna give them both a pin too.
I want one. I need
Okay.
another one. I wear outfits.
I got a different one for you.
Hey, what?
Oh, what? I'll go see. Okay, girl, you sit across from me.
I did not sleep.
I
did
bet.
not. It wasn't intentional. I just didn't sleep. I was up, going to lay down, get back up again. One of those things.
It's a big thing.
Yeah.
It's a big thing. It's a great, wonderful thing, but it's a big thing too. It's kind of scary.
Yes, it is.
But I think you're gonna do well. Remember now, we do this, you know, we're doing 9 living-related transplants in the month of October.
Oh my goodness.
9 living-related. We're doing a lot.
That's really good.
Yeah.
a copy of her schedule?
I have one right here. I need this because I need to follow her day, but I can make you guys a. Oh, there it is right there. She's got it right there.
does it.
Uh-huh.
Okay. Okay, so we're meeting right now, and at 10:30, and hopefully we'll be done a little early, maybe we'll see. You go see Dr. Hefty. He's the transplant surgeon. He's doing your surgery. He's the surgeon.
I think I've met him before.
Yeah. And then after him, at 11:15, and Dr. Hefty is on the same floor here.
Here, okay.
Okay, he's just right down there. Check in at the desk to see him.
Okay.
Okay, he's the surgeon.
Okay.
He's just right back here.
Okay.
And then George Glisson is our transplant social worker. Check in for him at the desk down there where you checked in for me.
Okay.
But it's all on the same floor. His office is right back there. Okay, that's our social worker. And then after you meet with George, I'm gonna send you to the lab for lab work, which I'm gonna tell you more about, and a chest x-ray. And if we have time, if there's some extra time when you're done with me, I may just send you to the lab a little early.
Okay.
Because everybody's always waiting on these labs.
Yeah.
And what we're doing is both you and Paula, it's a last minute check to make sure that there's no abnormalities, no infection. It's a complete blood count, and we're checking your electrolytes, make sure your potassium isn't high, make sure there's no infections. We just gotta make sure you're both healthy and everybody's ready to go.
Did we do that on the 5th?
We sure did. We gotta do it again. You know that test we did on the 5th?
Yeah.
That was the cross match. That's totally different. That is to do with tissue typing and the immune system. That was a last check to make sure that your cells will accept her cells.
Okay.
That's totally different. This is you making sure no signs of infection, your potassium's okay. And the same thing with her, make sure nothing's come up, you know. This is just such a big surgery, we just gotta make sure everything's okay. I know. Okay, so like I said, if we can fit you in here a little early to go to the lab, we'll do that. So then you're not gonna see Dr. Cooper until 1:20. You got some time for lunch, go to the lab, and then a chest x-ray just to make sure you don't have any extra fluid in your lungs, pneumonia or anything.
And what is Dr. Cooper gonna do? Just talk to her again, check her over?
Yeah, just check her over, make sure everything's okay. Talk to you more about surgery, answer questions. She's her nephrologist,
Right.
the kidney specialist. And then Elaine Ing, she's the financial counselor. This should be a pretty quick appointment at 2.
Okay.
She just reviews the finances. We're okay for finances. Let's see.
I hope so.
Yes, we'll check this out ahead of time. Yeah, you're fine, you're fine, you're fine, you're fine.
So what Medicare don't pick up Medicaid will?
Right, and the big thing with George and Elaine, they'll both talk to you. Remember now, I told you about this before, your transplant medications, which you have to take for the rest of your life, I'm gonna remind you about those, are very expensive. And Medicare and Medicaid will pay 100% of your transplant medications, okay? You
Which
all-
one will pay?
Medicaid.
Medicaid, okay.
And Medicare will pay some, so you're okay. You should have 100% coverage.
And I'm also on something through the kidney center that would pick up in there. I don't know, I don't remember what it was called. They would help out too, if something
Excellent,
comes up.
maybe George will know about that.
Yeah, okay.
Yeah, that's great, we wanna make sure you've always got your coverage,
Yes.
because your transplant medications can be about $1,500 a month.
Oh my God. Now, is Paula covered?
Yes,
Oh, good.
everything is covered for her under your insurance,
Right, good. Oh, great.
everything. Mhm.
Now, what's the $35 for today?
That is for the medications that you're gonna pick up at the pharmacy. You have to start your anti-rejection medicines tonight.
Oh, that's what that is?
Mhm. Now, you can get a receipt and save this and send this in to Medicaid,
Medicaid,
Right.
and they will reimburse you.
Okay, so that'd be to DSHS.
Right.
Now, does Paula, does she get that too?
No,
Oh,
you're the only one that's
Okay.
getting anti-rejection medicines, remember?
She's giving it up.
Uh,
She's giving up the kidney,
That's
so
right,
she has
that's
nothing to reject.
Do you know what I thought it was? I might get some. Oh.
Okay,
But that should be.
okay. Now this 2:45 pharmacy time here, we just put this time here, we just throw it in there,
Uh-huh.
so you remember to go.
Yeah.
You can go a little earlier if you have time.
Okay.
If you do go a little earlier, make sure that you check with me that you're gonna go,
Uh-huh.
because I have to fax, Dr. Cooper will order your medicines down there,
Uh-huh.
and I have to fax it down there, and they have to have the order before they fill them.
Oh, okay.
So make sure you check with me.
I will.
If you've seen Dr. Cooper at 1:20, they probably will be ready at, probably, it's gonna be a little later, probably 2:30.
Okay.
So this time probably is gonna check pretty good.
Okay.
But it's just an arbitrary time. If you don't have time, you can go later.
Mhm.
Anyway. And then 3:15 is the pre-op clinic. That is where you see the anesthesiologist. And remember what the anesthesiologist does?
He's going to talk with me and ask me if I'm allergic to anything.
Right.
You know, the deals, and probably tell me what kind of what he's gonna do, what kind
Right.
he's gonna use.
Okay.
That's right.
Right, remember I told you during surgery, the anesthesiologist, he's your best friend. He takes care of you during surgery. He makes sure that you're breathing. He makes sure that your blood pressure and pulse is fine. He's just taking care of you. Dr.
Okay.
Hefty, he's doing the surgery.
Uh-huh.
He's the surgeon, and he's very focused on that. So the anesthesiologist, he's, like I said, he's your friend. He'll talk to you today about the anesthetic.
Yeah.
He'll put you to sleep. He will tell you what medicines to take in the morning and what medicines not to take in the morning. Okay?
Uh-huh.
Okay?
Now, as far as the medicines I'm on now, don't take any of that at all anymore?
Now that's what I was just talking
Oh,
about.
okay, I'm sorry.
Those medicines in tomorrow morning,
Uh-huh.
the anesthesiologist will ask you very carefully every medicine that you are on.
Right,
He
uh-huh.
will tell you what to take tomorrow morning and what not to. Your blood pressure medications, any heart medicines,
Yeah.
generally they want you to take. Okay? Anything like vitamins or
Yeah.
Alu caps, don't worry about
Aspirin and
that.
stuff like that.
Now the aspirin, the anesthesiologist, you check with him on that. Insulin, usually they have you take half of what you normally take.
Okay, I'm not on this one right now.
You're not taking any insulin?
Not anymore, since I
Okay.
started on.
Oh, that's right,
dialysis.
good.
Yeah.
Dr. Cooper will talk to you about that in anesthesia. You can take pills in the morning, but with just a little bit of water. Okay?
Uh-huh.
Just a little bit of water. So that's kind of your schedule in a nutshell. I can answer questions throughout the day. I'm in charge of the whole day, so if there are any questions, you just come and ask for me and grab me, okay?
Uh-huh.
So I just wanted to review kind of the day. And sometimes this goes in perfect order and sometimes it doesn't.
Uh-huh.
So, when I send you to the lab, they're gonna check a complete blood count. They're gonna do a urine analysis, make sure you don't have any urinary tract infection. And it's 1 poke in the arm and 1 blood draw, okay? And then I have to let you know too, I let everybody know this. They will draw what they call a little pilot tube. And this is so we can send over 1 unit of blood from the Puget Sound Blood Bank. There will be a unit of blood here for you just in case you need it. We rarely give our donor or our recipients blood. But in case something happens, there are potentials when you have surgery for everybody, no matter what kind of surgery you have. So there'll be a unit of blood here for you, and that's what that little slip is for. Okay, so I'm gonna give this to you right now, and when you go to the lab, you just hand them that. But I just want you to know what they're drawing. You need to be informed. And this is your chest x-ray, okay? This is lab chest x-ray. Lab's on the 6th floor, chest x-ray's on the 5th floor, okay? I want you to do these. I'll remind you about these, but I want you to get these done pretty quick, okay? They're gonna do an EKG in the pre-op clinic. Remember what an EKG is? Yeah, it doesn't hurt. They just put the leads on you, check the electrical current of your heart. Okay, and they'll do that, like I said, in the pre-op clinic. Now, this is a little questionnaire for you. You fill this out during the day sometime, whenever you have time. It's just to check whatnot, front and back, and give that to the pre-op clinic when you see them today.
3 something,
Yeah.
That's the last thing.
You've got all day for that,
Yeah.
okay?
So just do this one.
Now, I want to talk to you about picking up medications from the pharmacy. Dr. Cooper, it has a little list, and she's going to tell me what anti-rejection medications you'll start tonight. And then what we're doing tonight, remember what your immune system does? Remember we talked about this? I know it's really complicated stuff.
And it's just,
What's the immune system do?
it keeps everything going more or less, and then when it breaks down, you have to have something to build it up.
Okay? Yeah, our immune system, it functions to protect us against foreign organisms. If we gave you a kidney transplant from a daughter or somebody that died, and we didn't give you any anti-rejection medicine, we can guarantee you, your body, your immune system, that functions to protect you against foreign organisms, it would reject it and get rid of it. We know what would happen. It would happen to everybody. Heart, lung, liver, kidney. Your body sees that kidney as foreign, and it'll get rid of it. The body's just taking care of you. So what scientists figured out about 20, 25 years ago was that if we could trick your immune system, we want to lower your immune system, so we want you to keep that kidney, right? Well, your body needs that kidney.
Yeah.
So we trick your immune system and we knock down your immune system enough so that your body just relaxes and says, okay, we need this kidney, we won't try to fight it and reject it. But the trick is, you can't knock off your immune system 100%, because if you knock it off 100%, you'd be in all kinds of trouble. You'd get pneumonia, you'd get cancers. You have to have part of your immune system, so it has to be knocked down. The problem with that is these anti-rejection medications have side effects, and which I've talked to you about, but I'm just going to remind you briefly. And you're always, from now on, for the rest of your life, going to be at risk for infection, because your immune system protects you against foreign bodies. That can be a sliver, a kidney, a cold, a virus, cancer. So for the rest of your life, and I don't mean to scare you, but you've got to be informed. You are always, always, always going to have to watch out for infection. Okay? Now the high risk time, we're giving you big doses of anti-rejection medications about the first 3 months. Okay? We're giving you big anti-rejection medicines. The reason is the high risk time of rejection is the first 3 months. Now rejection, the word rejection, it doesn't mean you lose your kidney. It does not mean that at all. We expect that 50% of people will go through some form of rejection. We just expect it. It's what the body does. It's what your immune system was, it's what God made the immune system do. Your body will probably try it sometime, okay? We expect it. We know how to treat it. We are very prepared for this. We know how to do it. And what will we do? You'll come see the doctor. You'll have blood work drawn. Maybe your anti-rejection medications will be adjusted. We have what I always call some big gun anti-rejections called ATGAM and OKT3, which I'm going to talk to you a little bit more about. These are what we call our big guns, okay? We've got these in our little bag of medications to use if we need them. So rejection doesn't mean you lose your kidney. It means that we've got to adjust things. Maybe you need an ultrasound x-ray of your kidney. Maybe you need a blood test. Maybe Dr. Cooper needs to increase one medication, okay? So like I said, we expect it. We'll teach you more about it in the hospital. It's always going to be one of those things that you have to think about. And like I said, the first 3 months, we really think about it a lot. If you can get to the first 3 months, 6 months, and out in a year without rejection, you're doing great. And that's what we hope. And that's what we hopefully will do. That's what we plan to do. So you start your anti-rejection medications tonight. We're going to just slow down that immune system a little bit tonight. In the OR tomorrow during surgery, you're going to get some anti-rejection medications, okay? But we start tonight, and that's what you pick up in the pharmacy. You're going to pick up some prednisone. Remember about prednisone?
Yeah.
I know that's the one everybody hates. I know. Prednisone is a steroid. You will be on this for the rest of your life, okay? I know nobody likes it. Your bigger doses right now at the beginning, and then gradually over the course of about a year, people get down to very, very low doses, about 7 milligrams, which isn't bad at all. But at the beginning, I'm going to be giving you more, okay? So I always start with prednisone because that's the worst one people don't like. Tonight, I want you to take all of your anti-rejection medications with food. I want you to do it with your dinner, okay? Because they're going to be hard on they can be hard on your tummy.
Right.
So take them with your supper. You'll take the prednisone tonight, and I doubt that you're really going to have any side effects tonight from your medicines. I seriously doubt it. You'll probably be just fine. Your tummy you may feel it in your tummy a little bit, but I doubt it. Another medication, and like I said, Dr. Cooper hasn't ordered things, so I don't know specifically what you're taking. Remember we talked about cyclosporin?
Yes.
Okay. Cyclosporin you'll be taking tonight. Cyclosporin's the really expensive one. Prednisone's cheap. It's like $6-8 a month. But cyclosporin that's the expensive one. And you'll take that tonight with supper. And cyclosporin people tolerate pretty well. You may feel a little bit warm when you take it. Long term, we have to monitor cyclosporin blood levels. Remember we talked about that?
Yeah.
I'll talk to you more about that. I don't want to overwhelm you with too much of that today. Yeah. We have to monitor blood levels, and it can give you tremors in your hands, give you a little bit of high blood pressure. That can happen, and I know sometimes you get a little nervous about the anti-rejection medications. Not all people get that. Most people do pretty well, but there are side effects, and you need to be informed. You need to know about them. You got to know. Wouldn't be right if we didn't inform you. But you'll do okay with that tonight. And the other medicine you'll probably take is Imuran or mycophenolate. Okay, and that's another anti-rejection medicine, and it works to lower your white blood count cells. It works on different cells that cause rejection. Okay, so those are the meds you'll get from pharmacy, and you'll start those tonight.
And why do you have to lower your white blood count?
Because the white blood count is
Fights
part of the
infection.
immune system.
Right, fights infection, so we need to lower that.
It'll try to fight off her kidney. So, excuse me, from now on in the future, we'll always watch your white blood count along with all of your other blood tests as well. Always. Now, okay.
And how many times a day does she take this medication?
I'm sorry, what was that?
How many times a day does she take her medication?
When you leave the hospital, you're going to be taking a lot of medicines. Probably about 30 pills a day. You're gonna have pills at breakfast, lunch, dinner, and bedtime. Now, right now at the beginning, you are on a lot of medications. You will not be on all of these forever. Okay.
Said to go along.
Right. Some of your medications that you're on now will continue, some won't. It's gonna be all changed around. It's gonna really confuse you. Like, what am I taking? But Dr. Cooper will keep you very clear on what you are and what you aren't taking, okay? But like I said, when you leave the hospital, you're gonna be probably taking a pain pill. You'll take that for a few weeks and then you'll be done. You'll be taking an antibiotic. You'll take that for a week or so and you'll be done. Stool softeners to get your bowels working, and then a week or two and you'll be done. So some of them will go away, but you're always going to be on 3 different anti-rejection medicines forever, for the rest of your life, and you gotta take them.
So when I get down to this decreasing, I'll be on 3, you know that for sure, and then some of my other medicines.
Right.
That I,
You may take some of them, you may not. Some
right.
people always require a blood pressure medication. Some people with a good working, functioning kidney can get their blood pressure down and not take any blood pressure medications. Yeah, and that's of course in everybody's hope,
Yeah.
but you may require, 1 or 2 blood pressure medications. And like I said, the next 3 months, your medications will be being readjusted, stop this, start this, up this. You really gotta stay in tune, and I'll help you, and Dr. Cooper will. When we see you in the clinic, I'll always go through all of your medicines with you and really help you, because it's a lot of medicines. I'd get confused.
Concerning diabetes, it's a possibility I might have to go back on insulin, but I hope it'll be in check to where I can just take the pills. That is a possibility.
That is a possibility, but there is a possibility that you might have to go on insulin. Now, we hope not. We'll watch it very closely, but the steroids can do that. They make your blood sugar level goes up. Just expect, Betty, that in the hospital, don't be surprised if your blood sugar levels run high, okay? You're gonna be getting a lot of steroids, so you don't reject your kidney. Your body's gonna be stressed. You're having surgery. You're getting a foreign organ in your body. Even though it's from your daughter, it's still seen as foreign. There's a lot going on with your body. And your body is gonna respond by your blood sugar levels being high. It's gonna say, yep, my body's stressed. Okay, and Dr. Cooper will take great care of you, and we just expect it. We expect all these things, but it's different when, you're the patient.
Right.
Like, what's going on here? Okay, before we sign the consents, I have the consents here. Let me talk to you more about surgery. Tomorrow morning, you'll check in very early, 6:37. They'll take Paula back first. They always take the donor back first. They'll start her case first. You'll be in surgery about 3 to 5 hours. Okay? You go to the recovery room anywhere from an hour to 2, 3, 4 hours. Some people go in the recovery room and they're there for an hour and they're out. Other people are in the recovery room for several hours, and families and friends always get really worried. You okay?
Excuse me.
Do you have a cold?
No, I think I got allergies.
Okay.
Oh, I had them when I was real little, and now they're coming back on me.
Yeah. So sometimes family and friends get concerned when their family members are in the recovery room a long time.
Yeah, I would.
Yeah, and I don't want people to get worried. To get out of the recovery room, you got to be able to breathe on your own. Your vital signs have to be stable, and you have to be comfortable pain-wise. Some people have a really hard time coming out of the anesthetic. Yeah, they take 3, 4, 5 hours, and that's just the way they are. So some people are in the recovery room a long time. Other people are in and out of there in an hour. But they make sure that you are perfectly stable, breathing on your own, and comfortable pain-wise before you get out of the recovery room. When you wake up, you're going to have an IV in your arm, okay?
Would IV be in there before surgery?
Your tubes, your lines and things will be put in while you're asleep. Okay? You're going to have an IV in your arm. You may have a bigger IV up here in your chest. Okay? That's called a central line. Okay? What's good about these is, number one, they put them in while you're asleep. It goes into a big, big vessel called the subclavian vein.
I've had that.
You've had them, okay.
Yeah, when I first started out.
Right,
Before
okay.
they put the shunt in.
That's good. What's good about having these is when you're in the hospital, your intravenous medications are given in here.
Oh,
And another thing is they can draw your blood work out of this.
oh, yeah.
Every morning in the hospital, you will have blood work drawn every morning about 6 o'clock. Okay? So it's really nice to have this central
Yeah.
line that can just draw your blood. You will have this taken out the day that you leave the hospital,
Uh-huh.
unless for some reason you need it in. Okay? So you'll have 1 or 2 of those. You're going to have an incision right over here.
Well, I'm on the right side.
Mm-hmm.
Okay.
About 4 to 5 inches. You're going to have a drain in called the Jackson Pratt drain. Everybody calls it a JP. It's like a little hand grenade, and it's connected right here, and then a little tube will go inside a puncture site. You'll have one of those. It'll be put in while you're asleep. And the reason that is in is to drain bloody contents around where they did all the cutting. So that will come out before you leave the hospital. Okay? And then you're going to have one other tube. It's called a catheter. And that goes up into your bladder. And it'll drain all your urine.
But they put that in when she sleeps.
All of the tubes go in while you're asleep.
And then, but when it comes out.
That's
You
when
know
it
what?
hurts.
They're not bad when they come out.
Oh, no, no, oh, they've improved, huh?
Yeah, I don't
Okay.
think
Because the
so.
last time she had it, it hurt.
It did.
Okay. Well, hopefully it won't be too bad.
No.
Sometimes a little sensitive.
What are they gonna put it, what are they gonna attach it to?
What are they going to attach it to?
Yeah.
Well, I could get you a picture. What they
No, it's
attach.
okay.
What they attach it to is they'll have her kidney, and then they'll have a ureter draining from it. Okay?
Okay.
We all have 2 kidneys,
Mhm.
and then we have a ureter on each of them. The ureter is a little tube that drains into the bladder. Here's the bladder right here.
Okay.
Okay? So what we do with a transplant is we take her kidney and the ureter, and then we connect it to your bladder. Pretty slick, huh?
So they remove her old ureter.
No.
It is connected to her old ureter.
They don't do anything with her old kidneys. They'll connect it to their bladder.
Oh, directly.
Mm-hmm.
Okay. And do they remove?
Nope, the old
Nothing.
kidneys
It
and
stays in
everything
there?
stays in there.
Huh.
Mm-hmm. Stays right there.
And the dear for Paula, they're gonna go where? In her back? Where they gonna go?
Paula, oh, her incision will be on the front, on the side. She's gonna have probably a little bigger incision than yours. Mm-hmm. And remember I told you her surgery is actually kind of a rougher surgery because the kidneys are in the back.
Mm-hmm.
So,
Yeah, they gotta, you say they gotta move this and move that.
yeah, and the muscles don't like being cut on at all.
So it is true that it's harder on the donor than it is the donee.
Absolutely.
I told Paula that. She just like, oh no, I'll be up and around.
No,
said,
I
don't
wanna- I
think
wanna-
so.
I want to really stress this with her again today.
Yeah.
Because she's going to have a lot of pain post-operatively. She'll do fine. There's pain medicine for it. I'll tell her about that. Most people today do pretty good with our technology.
Mhm.
But you're both going to have pain, but the donors typically have more incisional pain.
And you all are aware for scoliosis?
Yes.
Okay,
Oh,
that's
yes.
very
Oh,
very
yes.
concerned about that.
Of course, we're very aware of that.
Yeah, okay.
How long does her operation take, Paula?
About the same, 3 to 5 hours.
Does it?
Yep. So when you wake up, you'll have those tubes. That catheter is going to stay in you for about 5 to 6 days, and that's kind of a drag. You'll get tired of it the first day or 2. I think it's kind of nice because you're hurting. You don't want to get up. Just had major surgery. You don't have to worry about getting up to pee. You're going to be getting a lot of intravenous fluids. So you'll be making a lot of urine. Living-related transplants, we expect that you are going to, what we call diurese, and put out a lot of urine, and this is wonderful. I mean, this is what we want. So you're going to put out a lot of urine. So you could never keep up with going back and forth to the restroom. No way. And that's a great thing about this.
Yeah.
So you have that catheter in for probably 5, 6 days.
But it'll slow down eventually.
Oh,
you know.
yes.
This
Right,
is-
right at the beginning, your
Yeah.
body is getting a plump, fresh, healthy kidney. Your body is going to, whoa, and you're just going to work urine, get rid of urine. Your body's just, that kidney's going to work like gangbusters. You're going to feel so good in a couple of weeks. You're going to be amazed. You're going to be amazed. So those are the tubes and drains you'll wake up with in the recovery room. You'll go to the 17th floor. You'll be in a private room. Remember, I showed you the floor. You'll be in the hospital about 5 to 7 days. Dr. Cooper and I will both be seeing you there every day. And a couple things that you really need to do in the hospital. You need to do what we call coughing and deep breathing. And the first night, it's going to hurt. You're going to have an incision. You're going to just be out of surgery. That's the last thing you're going to want to do. But those nurses, they'll be bugging you to do that.
That's to clear the lungs.
Yep, keep the lungs clear so you don't get pneumonia. There are 3 potential complications with any patient that has surgery that we can prevent. Pneumonia, constipation, and blood clots. Pneumonia, what do you got to do? You got to cough and deep breathe. The nurses will show you how to get a pillow, and you press it on your incision and cough. And it hurts, but the pillow helps a lot. It sounds kind of funny, but press it on your incision. The nurses will show you how. During the night, tomorrow night, the nurses should come in and help you turn every couple of hours. They'll help you and they'll reposition you with pillows. They'll take good care of you, and they should help you cough and deep breathe. It's very important the first night or 2. You're not going to want to do it, but it's very important to prevent pneumonia. So what else can you prevent? Blood clots. What do you do about that? That night in surgery, the nurses help you turn, move your feet around. If you just think about it, just kick your feet around. Keep that circulation going. Keep everything moving. And then that next morning, there's absolutely no rest for the weary. The next morning, those nurses, they're going to get up and they're going to get you out of bed. The very next morning. The sooner you get up and get moving, the sooner you recuperate and get back home. So the sooner you get up in the morning, they'll help you. It'll be hard to do. They'll have tubes and drains, but they'll help you and get cleaned up, and they'll make your bed. And if you can walk a little bit in the room, that's fantastic. It helps the circulation, it helps the bowels get going so you don't have constipation, helps aerate your lungs so you don't get pneumonia. We have this immunosuppressant rejection, kidney stuff to think about, but we have all these other surgical issues to think about just because it's a regular surgery, but all of the transplant stuff. So you need to get up and get moving and walk in the halls as much as you can. And if you can't, nobody's going to force you, if you can't. But the sooner you get up and get moving, the better.
What floor is surgery?
Surgery is on the 6th floor. Now, do you have any questions about surgery or the hospital stay? No. Okay. Okay, now just, okay.
So now when they do the surgery, Paula's going to be in one surgical room, they remove her kidney, and then it's immediately, my mother's already under at that time?
I haven't been in surgery and seen it. I'm going to go one of these days. She should be ready and opened up and all ready to go, and that kidney goes in her. It's very, very quick.
Okay. And how long will Paula be in the hospital?
About the same time.
So.
Yeah, about 5 to 7 days.
Okay.
With her, I think we're going to have trouble keeping her down. I think she'll be out here.
Yeah.
She'll be running that floor over there probably. Have to keep her in check.
And then driving me crazy.
She'll be driving us. Get her out of here! Get her home! She's driving us crazy. Now, one other thing just about teaching, discharge planning, and education. We have a really excellent discharge plan and education program here. There's 2 videos you'll watch in the hospital. We'll tell you more about this. For each about 15 minutes, and we encourage you to watch them with your family. It's getting ready to go home. Our pharmacist comes and sees you and talks to you about your medications. And when you start eating and drinking, you're on a regular diet, probably about 4 days after surgery, the pharmacist will come in and set you up with a little med cassette and put all of your medications in there for the week. And we'll have you doing your medications, and pharmacy and your nurses will assist you. Okay? We call it SAM, self-administration of medications. Because we're not going to just hand you 40 bottles of medications and say, here, ready to go, see you. Call us if you don't have any questions. We're going to help you with that. A dietitian will see you before you leave, and we'll really guide you and help you a lot, and I'll be involved.
So now will she be on a strict diet once she leaves here? She'll be able to eat anything she wants?
Your diet will be diabetic, low sodium.
Oh, okay. This is like usual?
Yeah.
Okay.
Yes, but you'll be able to eat You know, milk again, you won't have to worry about your
Yeah.
potassium. But your salt, every one of us in this world should watch our sodium. All of us should. Okay, so that's pretty much my spiel. If you have any questions during the day, let me know. Let's sign your consents, okay?
Still feel okay about it?
Are you okay? Are you having
Yeah.
doubts?
No, I'm okay.
You can change your mind
I know.
and be in that big ugly machine.
You know, I think
Thank God.
she wants to do this. I know she does.
Yes.
But it's scary.
Yeah.
Now, did you know what you just signed to her, that you were giving me all your money?
You
You didn't even read it.
Because I didn't have any money, so.
So you knew you weren't giving me all your
Right.
money?
See, there was another question I was gonna ask.
So now she'll probably be out of recovery. She'll way before.
Yeah, she should
me.
be. You know, I was gonna tell you both too. I was trying to tell the family. You should be on the floor sometime, the 17th floor, sometime around 3-ish. I mean, I just try to give people a ballpark. Sometimes it's 2:30, sometimes it's 4:35.
Yeah.
So don't be panicking if, you know, they're not there. I'll be checking on them in recovery room.
So surgery's gonna start, we're gonna be here at 6:30. Surgery's gonna start at what, about an hour later or?
About 9 o'clock,
About
it
9.
officially starts.
Ah,
Like I
okay.
said, the pre-op clinic will give you the exact times tomorrow.
Right.
But generally, surgery is starting at 9 o'clock. There's a bunch of prep and pre-op stuff and doctors and
Yeah.
You've been through this.
it's a lot of
time.
stuff. Okay. If you think about it, you just let me know.
Yeah.
So Paula will be under also, I'm sure, right?
Mm-hmm.
She'll be.
They'll start her first.
Uh-huh.
Now this one right here, I want you
Did
to read that.
this one? Okay.
I want you to read.
Okay.
Have you getting your glasses?
Yeah.
Okay.
If I can find my purse.
I took it.
How much am I time? Let's see. 10:30. Find it. Probably forgotten at home or something.
They're here somewhere. When we have to go down in these one section or.
Yeah.
Okay, now what is this number 5? I hereby consent to disposal or use of research purposes any tissues, parts, or products of conception which may be removed.
I can honestly tell you that does not happen. This is the general consent for the hospital.
Right.
This is real specific to transplant. This has to be in here to cover the hospital legally. Let's say they remove they get in there and there's some tissue and the doctors are concerned about it. This looks kind of suspicious. They didn't plan on it, they remove it, they send it to the lab and they check it out.
Right.
They have to put this in here. I've never seen this happen in 14 years of transplant nursing.
Oh, okay.
But, I mean, I want to be honest, it has to be in there just to cover the hospital legally.
Well, the way that it's worded made it sound like
It's
research
kinda-
for going to a university.
I agree. I think
Okay.
the way a lot of people ask about that. I think the way it's worded is kind of makes you.
I don't want to fool you some of things. I've had that.
That's the steroids.
Yeah.
But the dose will go down.
Yeah.
Yeah. In about 3-4 months, it gets down pretty quick, Betty.
Okay.
I know everybody's concerned about that. Yeah, I would be too.
That's okay. At least we'll get to go shopping.
Yeah.
Anytime you want, not have to wait till you get off the machine, see if you're gonna be well.
That's right.
You can go shopping with the round face, it's okay.
That's right. I think she'll be surprised at a few months how good you'll feel.
the donor situation, the living donor situation seems to be getting better. So that
Well,
was really bad.
It, I think what happened was during the summer, the surgeons had vacation time
Uh-huh.
in July and August. And then all of a sudden, we had these living related patients and donors that couldn't get in the summer. We couldn't fit very many in the summer. So it's like, oh my goodness, all of a sudden October, and I think November, December will be very full. That's okay though. Well, we like it.
Hope you won't get pimples.
I know.
Hmm.
Get out the,
Candy Freeze hair growth.
oh, I need my hair back, my hair fell out. I'm waiting for that.
Everybody has a couple things they like, a couple
Right.
that don't.
Lost all of my
Well, let me help you then.
hair.
That's cyclosporin. I know, it's Did you read that all through?
Oh, I did.
Okay,
Yeah,
okay.
because I was talking
Yeah.
about the, oh,
You're the first line to let. That's,
weakness of the muscles and so all that good stuff. Oh, what's, aseptic?
aseptic necrosis?
Yeah.
Okay. That is to do with the prednisone, and that can happen to your bones. I see this happen rarely. If it does happen, it's pretty serious. I've seen people a couple times have a hip removed and have an artificial hip put in. I don't see it happen very often at all.
You know, the bones is, and weakness of the muscles, those are both on here. You know, I know about the bones and, you know, unless I'm taking some calcium or something.
Right. Yeah, and Dr. Cooper is, she's very, very pro watching women on dialysis,
Uh-huh.
with osteoporosis in their bones.
Yeah.
Because you've really got to, you really gotta watch for that. And she's very, very pro
That's
taking care of bones. Yeah, it is.
Hip and some people have, you know, all of it almost.
Yeah. Okay, now I want you to look this one over right here. I have went through all of that with you, but that is written down.
Okay, that keep this?
Yes, that is
Okay.
yours, but I just want you to look that over.
Uh-huh.
Like I said, I went through everything with you, and I want to remind you of a couple important things. Right, after midnight tonight,
So we'll
Nothing.
just have a big dinner tonight.
yeah. Now, if you or Paula, and I have to tell you this, if you or Paula accidentally had breakfast, surgery would be canceled, okay? And like I said, the medications for you, with a little sip of water, that's different. And you check that with the anesthesiologist,
Okay.
that's important. Because I think there's several medications they're gonna want you to take,
Okay.
yeah.
Sure. Added risk. Excuse me.
What is the, Imuron?
Imuran,
Yeah, Imuron, what is that?
that is the one I talked about, that's one of the 3 anti-rejection medicines. And people tolerate it pretty well, it can decrease your white blood count.
Okay, that's the one, okay.
Yeah.
And then
You watch your
Cellcept?
white. Cellcept, that's mycophenolate, that's another name. You will take either Imuran or mycophenolate, not both.
Okay. I seen that
One
in
of the
other notes.
anti-rejection, yeah.
Okay.
There's a lot of names, it's hard to remember all of them. Okay, now, let me just check it over, I just wanna make sure. Oh, I never mentioned the shower. When you go to the pharmacy, you're gonna get a bottle of Pfizer Hex. You probably know what it is.
Oh, yeah.
Yeah, yeah, see,
I
I knew
haven't
you
heard
did.
that in a long time.
Five,
It's used all the
you
time.
used to use it with your kids?
Oh, yeah.
See, yeah. Oh, we used to use it a lot, I guess,
Mhm.
my mom used to use it on my knees. So you'll get a bottle of this tonight. and it's kind of expensive, but we just get one bottle, and then you and Paula split it.
Okay.
You just
all right.
need a little bit, you'll have leftover.
Uh-huh.
And mostly concentrate on your tummy, that's gonna where the incision's gonna go.
Uh-huh.
And it's just to take the germs off your body so you don't get infection in that incision.
Yeah.
Because infection is something, you know, we have to think about. So share that tonight, take that shower. If you wanna do it in the morning, that's fine. You can shampoo your hair or do everything normal with your hair, don't put it in your hair. The anti-rejection medications I told you about, the medications, nothing to eat or drink after midnight. That is yours to keep, that's your reminder. Paula gets one too. We're gonna have her start today about noon,
Oh.
drinking a ton of fluids. We want her to have a nice, plump, hydrated kidney.
Oh, yeah, okay, I see.
There's a little bit of difference. You kind of watch your fluids a little bit.
Right, yes.
Okay, that's everything. The other doctors, you know, they're gonna go through some of this stuff with you probably. I'm probably the most thorough.
Mm-hmm,
Of course, the nurse.
yeah.
Don't get that. The nurse goes through all of that. Any other questions? Anything else?
I just hope everything goes well.
Well,
I think it will. Okay, you doing okay?
Uh-huh.
Okay. Okay.
now what's gonna be my role when they come home? They're coming to
You're
it.
gonna be busy.
My
Don't
house.
kid you.
I know.
They get you.
Paula says, I'm gonna
Roller
ring a bell.
skates.
I said, you better not ring a bell.
Yeah, I have 3 bells, so we have,
They're gonna work you, girl.
They're gonna drive me crazy.
Your role is, generally, people that have transplants and donate kidneys, they do not require, quote, nursing care. Unless there are complications and things that go on, we would help you with that and, you know, train you and do whatever we had to do. Generally, they can take care of themselves and bathe themselves and go to the bathroom and take care of all those personal things. Oh, yes. The things they're gonna need help with are cooking, meals, laundry, housework, those kind of chores. But they can walk and they're gonna take it pretty easy the first week when they get home. But I think they're both gonna be amazed at how good they feel in about 2 weeks. 2 weeks, it's like, gee, they didn't even have surgery. And Paula probably will go out and do way too much stuff about the 3rd week. And then she's gonna exhaust herself. And it's like, oh my God, I'm exhausted. It's like, because she did too much. So I think people have to, about 2 weeks, you have to do energetic things. Maybe, you know, going to the doctor office will be a big deal. Maybe run an errand and then go home and rest. Then have some activity later and then rest. So you want to alternate activity with rest, activity with rest. They're going to do fine. I think she's going to need help with her flow sheets. We'll tell you more about this in the hospital. But she's going to have little flow sheets to keep up. They're going to have to get your weight once a day and record it on your flow sheet. You're going to have to get your blood pressure twice a day, morning and night, record it on your flow sheet. And your temperature, morning and night, record it on your flow sheet.
and they just like, do that.
Yeah, that's what you were telling me.
And then,
So she might need help with her flow sheets.
Okay.
And then her medicines, it can be a bit overwhelming. But we'll do a lot of teaching in the hospital, and you can be supportive in that. They're going to need help probably, you know, going back and forth to doctor appointments, especially you, the first month. Couple,
coming back twice.
yeah, at least twice a week with blood draws each time. Gotta keep a close eye on you. We gotta, I know.
Also, would it be possible to get a blood pressure, something, you know?
You need a blood
I
pressure
can't
cuff?
read those things, yeah.
You bet, I'll get you one.
Okay.
Do you have a thermometer?
Yes, I
We
do.
do, yeah. And then I saw one in my supplies. It's a cover and it has a little line on it, so when I put it on, I guess it would come in onto the bill. When it'll show up, the numbers. Well, it was in my supplies. It's got a cover on it, and there's a little window. I think it's a thermometer, I'm not sure.
It's in your supplies.
Is it come with the battery?
I'm not sure, I didn't really.
Oh, I'll look at it.
I didn't really look at it.
If you need a digital thermometer, we
Yeah, I think
have them
it's-
here,
Okay,
and I'll give you one.
okay.
Yeah.
probably
When I
just-
see
it must be
then I
digital.
feel, yeah, I think so.
Yeah, it must be.
I'm not
Yeah.
sure, I better take one anyway.
You want one?
Yeah.
You're funny. I'll have to take one anyway.
Yeah.
Do you guys have a scale?
Yes.
Yeah.
Okay.
Mm-hmm.
Well, yeah, you're mostly gonna be supporting, running errands, cooking. Like I said, they're not gonna need nursing care.
The scale is in, what you call that, milligrams? The scale is not in like 165, it's in like 66.5 or something like
It's in
that.
kilograms.
Yeah,
Kilograms.
kilogram, yeah.
That, if it's pounds or kilograms, either way, just
It's
as long as
okay.
it's the same scale at home all the time, we want it consistent.
Right.
Okay,
Alrighty.
now, your next appointment is 10:30 with Dr. Hefty.
Okay.
Now, we can do one of two things. You can take a break, go get some coffee, see Dr. Hefty at 10:30, same floor. Or, if you wanna go to the lab and get your blood drawn, I would like that.
Yes.
I
I
would
want to
love
do
that.
that too.
But like I said, if you don't want to,
Yeah.
you can do it later.
6th floor blood,
We'll do
5th
that.
floor x-rays.
I doubt that you're gonna.
You missed this over here.
You didn't really want to, did you? Good.
Hello, people. It is Holly. Oh,
Boy,
how are you doing? I was just sleeping. I'm way patient for my turn.
okay.
Hi, I'm Wanda Ryan.
Oh, hang on a second. Wait.
I'm
Stand
already-
back. You're gonna have to stand back a little bit. I get a focus on you. And you can just stand where you are. Stand still, Wanda. Oh, there you go.
Tell me when.
Sure.
Okay.
Okay. Hi, I'm Wanda Ryan. I'm your transplant coordinator who's going to be working with you today. You ready to come on back?
Yes.
Come on, girl. Let's go. And you're going to have a fully catheter that goes into your bladder, goes up through your urethra, and it drains out your urine. Okay? That's put in while you're asleep. The first night, you're going to be glad that you have it, because you don't have to get up and pee. It's going to be nice, okay? You'll have it in for probably 3-4 days, okay? Depending upon the thing that usually stops the donor from getting that catheter out is the medication you're going to be getting, which I'm going to tell you about, pain medication. Because some of the pain medications cause urinary retention. And what good would it make, what good would it do to take out your catheter and you can't pee and we have to put it back in? That would just be more stressful. So, in my opinion, and this is the opinion of the doctors, it's better to leave it in so we know you're not going to have urinary retention with your pain medicines. You want to make sure you can pee when you get the catheter out. Okay, the reason it's in is we got to let those incision sites that are inside you that you can't see heal. They got to heal. Okay? So you wake up and you're going to have at least 2 tubes. One other tube that you're probably going to have, I want to talk to you about pain control. And you know, I've told you that you are going to have postoperative pain. You are going to. Okay? There's 2 ways that they can keep you comfortable. There's what they call an epidural, and you'll probably have an epidural unless you're, you know, really opposed to it. You'll talk to the anesthesiologist about it tomorrow. I'm sorry, today. He's an expert on postoperative pain control. And you can ask the anesthesiologist a lot of questions if I don't answer enough. Most of our donor nephrectomies have an epidural. They're put in while you're asleep. It's a little tiny catheter that goes into your low back, and moms use them a lot with labor and delivery. And they started using them the last, oh my goodness, many years, for post-operative pain, and people do very, very well. The tube goes into your low back, into the spinal column, and it goes to the epidural sites where we feel pain in our spinal column. And this catheter goes in there, and it's taped. You'll feel the tape on your back. You'll be like, what's on my back? You'll feel this tape, and it'll go around over here, and it'll be taped on your shoulder, and it'll go over here to this little box. And this is a little tiny computer. And pain medication is delivered in that little small spinal column that goes to your spinal column.
Okay.
And what this pain medication does is they give you one medication called bupivacaine. It's like Novocaine. The doctor numbs you when you do mouth work. And this numbs you. And this is the great part. It numbs your incision. Wouldn't it be great if it was numb? And then they give you a synthetic morphine in there as well. And that helps you with pain control. And together, those work very, very, very well. Can't overdose, can't get too much. And then there's a little button. Let's say you need more pain medication. Well, some people do. You can hit the button and get more. If you don't need it, don't use it. If you need more, hit the button. Now, if you're hurting after surgery, it's your job to tell everybody. There's no awards. There's no awards for taking a nose pain. Okay, so you tell people. A lot of people will ask you, what's your pain level on a scale of 1 to 10? 10 is the most pain you've ever had in your life. 0 is none. So they'll ask you to rate your pain level. Okay, so I'd say 1, 2, or 8 or 9, you're screaming, you're having a lot of pain, help me. So that's the epidural. Most of our donor nephrectomies do very well with those. And I think that they will want to give you one. Let's say you don't, for whatever reasons. The other way, and this is what your mom will have, it's called a PCA, a morphine patient-controlled analgesia. It's a little box over here, set up on a little computer, and it hooks up into your IV, and you hit the button, and you get morphine or Demerol intravenously. The problem with that is the side effects of morphine makes you sleepy, and it can make you nauseated. The epidural, you're more awake, you can move, and do all the things you gotta do to recover and get out of here.
Hey.
So, the anesthesiologist will talk to you more about those, but I really, I think they'll wanna give you an epidural.
This area. I think this is almost one of the...
And from Seattle Center, we're going to go to the Woods home and see what we can get from Betty and maybe even get some Mita in there. And if all goes...
shoot out here, my sense is that we'll have to come back and do more MOS shots and not use this as everything. We'll just hopefully get some good stuff out of here and come back later. Right. Good morning. Hi. And you are?
My name is Mike Nussbaum, N-U-S-B-A-U-M.
Okay, thank you, Mike. We're here because we'd like to get your opinion on organ donations. Could you share with me your thoughts on that?
Well, to me, it's the most important thing in the world. I've been involved in this where I live in Canada, and it's, I mean, I've gone through the economics of it, the cost of a transplant versus the cost of dialysis over time, and it's economically a good thing to do. It's quality of life a good thing to do. In all respect, it's a good thing to do. And I happen to be an advocate for organ donation in Canada, and in fact, I'm trying to get a program going in Canada very similar to the UNOS program here in the U.S. So I just came back from a conference where that's exactly what I talked about.
Very good. Could you tell me what motivated you to become involved with this organ donation process?
It was actually through work. I did a project where I designed an organ donor registry, a computerized organ donor registry for British Columbia, and it kind of became a little bit passionate objective of mine because I saw all the good it was doing, and so I've been kind of advocating personally now to do this on a national basis because the waiting lists are huge, and I've known personally people who have had transplants whose quality of life has, you know, just rocketed to the sky, and it's just such an important thing, and I've been a believer in it for some time.
Thank you. What is your sense of the feeling of organ donations in British Columbia? Are people volunteering as readily as you would like, or do you find reticence in becoming active?
Actually, there's been some studies done on this exact point, so I can talk with a bit of authority in the fact that most individuals, when asked, would gladly be an organ donor, volunteer to be an organ donor. What we're trying to work on is mechanisms by which people can do this more easily. We have the objective of the organ donor registry was to take this off the driver's license and put it on our health system. So we have universal health care in British Columbia, so therefore it's now associated with our health card and our health number, whether you want to be a donor or not. It's not, the driver's license doesn't make much sense because when you go to a hospital, they take all your stuff away and pack it away or send it home or whatever, so people just don't know. We also have really good legislation in British Columbia. Two things. One is there's an act called the Human Tissue Gift Act, which basically does not require the consent of the next of kin. So therefore, if your wishes are known and well documented as an individual, then that takes precedence over the family, who is very bereaved at the time and very difficult to basically talk about this topic. So the other thing that's happening is compulsory referral of any candidates for organ donation in the hospital. So this is legislation now that requires people in intensive care units to go through a protocol, the medical staff to go through a protocol to identify potential organ donors and make sure that any effort that is possible is made to ensure that they in fact are organ donors.
Very good. Thank you very much for that perspective.
I bet you weren't expecting all of that, were you?
No, thank you. Don't get me my left.
Whenever you're ready.
Okay. The way the organ donor registry works in BC, British Columbia, is that people get a form to fill out, and they get this when they renew their driver's license or when they renew their health card, and when they go to certain drugstore chains that have bought into this, so there's private sector involvement as well. And they get a form, and if they fill out basically their health care number, we have, because of universal health care, that identifies everybody. It's great. So they fill out their health care number, and then they basically all put down their wants and wishes in terms of organ donation, and then they sign it. And they mail it in on a postage page envelope to the BC Transplant Society. The BC Transplant Society is a provincial agency that takes care of all donation and transplantation for all of British Columbia. It's kind of a unique thing, and it allows the funds to flow and be coordinated, etc., including for the operations. What happens then is they receive these forms and they scan them into this computer system, which lifts off their healthcare number and puts us all into a database, such that if somebody is in intensive care in the far-reaching community, any hospital, they can dial a 1-800 number on the phone, and they have to identify themselves through security, and then they are asked to put in their the health number of the individual that is a potential candidate for donation. And the technology is called IVR, Interactive Voice Response, and what it does is it basically comes back and says, yes, this person's in the registry or not. If they are in the registry, then they have the ability to have it faxed to the intensive care unit in the middle of the woods. So out comes the form with the signature and everything, and then they can take this directly to the next of kin, and the next of kin can see the person's wants and wishes directly, and it's very powerful. So this just got going in 1997, and as of now, I think there's 300,000 in BC, which is about 10% of the population. So they're working towards 100%. It'll happen as the re-registration of the health cards and the re-registration of driver's licenses sort of works through. If you want to find out more about it, there's a website. It's www.bcts for BC Transplant Society.bc.ca, and there's a full description of the organ donor registry there. Okay. Fade to black.
Good stuff. I'd like to have you sign a release when we finish so we can use your image. Yeah. Here it is. Okay.
Okay, start again.
Okay, may I have your full name, please?
My name is Ronald.
Your first and last
Ronald
name.
Tyrone Allen.
Okay. Tyrone, could you tell me, are you a registered donor, organ donor?
Not really, but
Well, do you have any feelings about organ donation? Do you have any opinions you'd like to share with us?
no. If it's something that you want to do, then you should do it.
And why do you?
Something good out of that, you know.
Okay. Why do you feel that way?
Huh?
Why do you feel that if it's something you want to do, you should do it? Are you going to do it? Do you plan to do it?
Maybe sometime in the future, you know, help someone or something, you know, something like that. Yes.
So maybe sometime in the future to help someone. Okay.
At least, you know, that kind of, you know, support. Yes.
Thank you very much. Let me get you to sign this, please.
It says in Acts chapter 26, verse 18, it says, Jesus of his own, for he is a liar and the father of it. And because I tell you the truth, you seek to kill me. That's what Jesus said to certain people in the Bible. He said, because I tell you the truth, you seek to kill me. Hey, blessed in the sight of the Lord are homosexuals will not inherit the kingdom of God. The Bible says that a man shall not lie with womankind.
Oh, that's fine. We won't call you.
For God so loved the world that he gave his only begotten Son. Blessed is the man when men will revile you and persecute you and say all manner of evil against you falsely for my name's sake.
Thank you very much, Mr. Allen.
Exceedingly glad, for great is your reward in heaven. For so persecuted they that promised before you.
All right, preacher man.
Okay, let's
Okay,
go.
back
Here we go
together.
up to.
Remember, I've got one eye in this thing, so you
Okay.
have to pay attention to our wire and the feet and our feet.
I got it. Here we go to Preacher Man, and we're going up to him, as you can see. Let's see.
Hey, you know what God says about you?
Let's go over this way.
Except the Father which has sent me, draw him, and I will raise him up at the last day.
Here we
Jesus
go.
says, you have not chosen me, but I have chosen you. Hi, how do you do?
Hi. We're making a video on organ transplants and organ donations, and
Yeah.
I'd like to know if you would like to give us your opinion about it.
I think it's
What is-
absolutely fantastic.
Okay, could you give us your full name, please? 'Cause
Yeah.
we're going to ask you to sign a release
Okay.
letting us know whether or not we can use your name.
Yeah, my name is Mark Gardner, okay, and yeah, you can use my name. I'm an organ donor, and I told the guy I went down and got tested for the AIDS virus. He says, would you, and I was negative. He says, would you like to be an organ donor when I went in to get my driver's license renewal? And I think it's a great, wonderful thing. I mean, what are we going to do with our bodies when we're dead, right? Why not let somebody else have a piece of us and save someone's life? And I don't know why anybody wouldn't want to do that. I don't know, you know, maybe you want to just take it all with you. You know, to the crematorium or to the grave, take it all with you. Some people are buried with their diamond rings and stuff. They don't leave them to their children for an education or whatever, or give it to the poor. They want to take it all with them. The pharaohs, right? The pharaohs, right? Weren't they buried in a solid gold sarcophagus? They were buried in a solid, they took it all, and then they even took their servants with them, didn't they? They took their servants, they took their concubines and their servants and their dogs and everything, their cats, everything was buried with, they took it all with them, didn't they? Well, hey, right on, why not be an organ donor and do something good for somebody, for humanity? It's a good contribution for life. Well, how's that? Is that okay for a nice little, okay.
That's absolutely great.
Okay.
Thank you.
Yeah. Hey, have a nice day.
Thank you. Can we get you to sign this release,
Sure.
please?
Yeah.
this is very good.
Let me sign your release. Yeah.
Okay. Here we go. Here's my pen, and there's the. Very good. Thank you.
Oh yeah. Please print. Okay.
Remember us in your prayers. We're trying to do good work.
Yeah, I will. 10:10.
I think so, or 10-9
Something
or
like
somewhere
that,
in there,
yeah.
yeah.
I think that, you know, people who commit murder and all that kind of stuff, and then they go to jail, they shouldn't be let out in 25 years or 15 years. I think that they should become property of the state, and they can receive Christ in prison, right? But they gotta pay their dues, right? And I think they should become property of the state, where the state can actually, once after they're educated, have them executed in a way where nothing's damaged, and then it goes to the hospital. Okay, kind of retribution on their crimes.
Should they have a choice in doing that, or should that just be a normal?
No, they murdered somebody. They don't have any more rights. They don't have any more rights. I mean, like day of birth. Okay, I hate to use Hitler as an example, but you know, if you didn't like it, you went up the chimney. You went up the chimney. I mean, at least these guys get to go to prison for 20 years and then they get let out, or you know, most of them just get let out. But I mean, you know, it's kind of nice where you can go to prison for 20 years before your execution and have 3 meals a day and play ping pong and baseball and chess and have a lover in your jail cell with you. Have a lover in your jail cell. How about a couple of them? Think about it. Think about it. I mean, you know what I mean? Himmler and these guys, you know, they had a quicker solution, right? They just dig a pit and throw you in it, or you know what I'm saying? And I don't know why I brought that up, but I think that they should become property of the state. They shouldn't have any rights. I mean, they committed murder. You just killed somebody, man. And I think that now we're going to get some good out of you. We're going to see if we can't get some. We're going to get some good out of you. And also, I believe in conversion. I mean, I believe in getting these guys saved. You know what I'm saying? And I don't care what they did. I mean, I believe try and get them saved, you know, in prison, and so that they can go to heaven. You know, I'm sorry about the person they killed. You know, maybe the person that they murdered went to hell. You know, it doesn't sound fair, but that's the way it is. Hey, have a nice day, okay?
Thank you very much. Thank you.
Okay.
Okay, Speed.
Okay, good afternoon. And you are?
My name's Penny Stroud.
Okay. Penny Stroud, could you give us your opinion about organ donation?
I believe strongly in it. I've ever since California had a driver's license donation process, I've been a member and have always believed in it.
What do you believe in it about?
Well, I think for the most part it doesn't do any harm to the person or the family making the donation, and for those that it makes a difference of whether they live or die, it's a critical difference. I have a daughter with cystic fibrosis, and I know at some point she may or may not need a lung transplant, and you know her life will depend on either me or somebody else donating a lung.
Are you aware of the registry system for donating organs?
Yes, I am.
So you're in touch for your daughter?
Right. Well, actually, I'm not. For my daughter, I work in the health industry, so I'm familiar with the donation system.
Okay, thank you very much.
You're welcome.
Yeah.
Good luck.
Could we get your to sign?
Oh, yeah.
Otherwise, we couldn't use you. Thank you.
Oh, you're welcome. Good luck. What are you doing this for?
Well, we have support from the National Kidney Foundation and other organizations, so we're just...
What's the date today, the 10th?
I think it's the 10th, isn't it the 10th? Oh, Menlo Park. I'm from San Francisco, Berkeley, Oakland. Thank you very much.
Okay, good luck.
Yes.
So I came around this way a little bit because of why.
Okay, but you got his name?
No.
Okay. Okay, good afternoon, sir.
Hi.
Could you give me your name, please?
Yes, Kim Isaac Williams.
Okay, Mr. Williams, could you give me information as to whether or not you are an organ donor?
At this time, I'm not.
Okay. Is there any reason you aren't?
No, actually, no reason at all.
Okay. Are you aware of the fact that people are receiving organ transplants?
Yes, but not to any large degree. I don't, I see it on TV and whatnot, but I don't know anybody that's affected by organ transplants and things of that nature.
Do you have any opinions about organ transplants?
Not necessarily. I have heard of cases where there have been rejections of the donor organ or what have you in the recipients and whatnot, but I don't have any real opinion in regards to it.
Do you plan to ever become an organ donor?
I don't know. I'm a little shaky on it. I don't know. The idea of one of my organs in someone else's body is kind of foreign to me.
So is there a fear involved with this?
A little. I think anyone would have a little bit of fear of having someone else have a part of what was theirs. So yeah, just a little bit.
How would you feel about it if you were one person who needed an organ transplant?
Well, I hope someone will show sympathy. Otherwise, I have to count my losses, I suppose. But I would hope someone would be sympathetic towards my struggle.
So you would be willing to receive an organ?
Yeah. If it meant my life, yes.
Okay. Thank you very much.
Thank you. Thank you.
May I get you to sign this for me, please?
Sure. Hey, what's going on, Keela?
And if you say yes, I'll ask you why. If you say no, why, and get your opinions on the organ transplant.
Okay.
People having organ transplant. And whatever opinion you give is fine.
Okay.
Try to stay
Okay.
nice and close to each other, okay?
Oh, do we have to?
You have to, just like...
Where are you from? Okay. Let me go. Okay. Good afternoon. May I have your name, please?
My name is Liz Jones.
My name is Becky Shoemaker.
Okay, I'm here to ask you whether or not you are an organ donor.
Yes, I am.
Okay.
And no, I'm not.
Okay, may I ask why you are an organ donor?
Well, I just feel like after I die, if I have an organ that can benefit someone else and help them to continue a healthy life, then I want to help them with their life. I don't need it anymore, so someone else should be able to use it.
I'm actually undecisive at this point. I've looked into it and I have mixed feelings about the youth of donors. I know it's a good program, but I also have mixed feelings about it.
And what are your mixed feelings about it?
Well, I just really feel that sometimes things can go too far, and so that is why I have not yet. I am actually right in the middle of looking in libraries and different things about organ donors and when people can say no, when people can say yes, and the process of that.
Tell me this, if you needed an organ, what would your feelings be about receiving someone else's organ?
I've been asked that. Of course, I'm sure I would want an organ, and that's what's really difficult. If I had to make that decision, I think the most difficult decision for me is the fact that who it is and why they died and how they died, and I don't know if I could get through that part of it, and knowing that that person is in me. I'm just not sure I could deal with that. So I don't know if I would accept an organ or not. I really don't know.
Even though that person had expressed an intent to have their organs used for someone else's life?
Yes, I still don't know if I could do it. I really don't know. I think it would be a matter of when it happened, I would pray about it and I would have to decide at that point.
Thank you. And could you tell me what motivated you to consent to become a donor?
Well, I've had friends who have had cancer, who have had bone marrow transplants that have saved their life, and as I heard about that, I just thought, wow, there are people out there who are being recipients that are going on to live healthy lives, and I'm really not doing anything. This is something that I can do to make a difference. I do have a little bit of fear of, how they make the decisions. Sometimes I hear it's pretty political in hospitals about who gets the organ, so that's a concern. But I know there are plenty of children out there who are benefiting through kidneys, and now they can do the heart transplants, and so I just, I guess the same thing, I just have to trust that God would make sure it was in the right person, and hopefully it would go on to help them live a productive, healthy, good life, and not a criminal life or something like that. So anyway, but yeah, it's just a way that I can help. I've tried to give blood before, and a lot of times I tend to be anemic, so I can't always give blood. So I thought, hopefully I could be an organ transplant and benefit someone someday.
Thank you very much. Thank both of you.
Thank you.
Yeah. Where are you from?
Puyallup.
Where?
Puyallup.
Oh, Puyallup.
Yeah.
Oh, okay. I thought you. Yeah. Oh, okay. You're a Washingtonian, so
yeah.
yeah.
Yeah,
good.
we're Washingtonians. Yeah, we are.
Now you can really tell the girls what's going on here. May I get you to
We're
sign?
going to debate this all the way home.
I know, because I was listening to you thinking, oh, that's true. That's
We're still filling it.
So hopefully everybody else
I was
will.
actually reading the other day in a book, and it talked about that, surgeons moving people up the list and that kind of thing. And
That's why I'm under.
oh, that's kind of.
Well,
But I still think
we'll see.
overall it's a wonderful program.
I actually do too. It's just that is my biggest concern. So.
And then I'd like to get your candid remarks, if I may.
Now, are you trying to get
Originally,
funding
no.
for this program or something?
How did you know that?
I don't know.
Have an accent.
Oh.
And I key up on it. It's really subtle, like you've been trained to live in Toledo, Ohio, like most broadcasters. But there's a sense I can tell where it's from. And I've always been able to do that. I don't know Chinese, but I've been able to spot where an Oriental, what part of the country it came from.
Tell me, Northern or Southern California?
Southern.
I grew up in Southern California, but I've lived, I guess, the past 25 years in Northern, so I was curious.
Yeah, I just renewed my license yesterday, so they asked me again if I was.
Did they? Okay. Yeah. Well, actually,
I guess you can't wash it
thinking
off.
about it today. Driving here. I haven't.
It's like I was born in Kansas.
In where?
Kansas.
Oh, they're probably starving and going, oh my word.
I know. Well, that's what they get.
Well, you have food for thought that you're bringing them.
That's right.
Yes,
Now we can
yes.
have a lovely.
Leave it to me.
No, actually, it's a good topic. It really is a good topic.
Thank you very much,
Something to
ladies.
Thank you.
Yeah, thank you. Good.
Are you trying to get funding for the program?
Yes, we
Is that
are.
what you're doing?
Yes, we are.
For the organ donor. Just want to make sure I'm supporting you.
Okay.
Okay.
Is he? How is he? Okay.
Oh, she's cute. That's nice.
No, bless you.
Okay, I got speed. Go ahead.
Okay. Could you give me your full name, please?
Blyford Nesbitt.
Okay, Mr. Nesbitt. I would like to know: are you an organ donor? Have you registered to become an organ donor?
Yes, ma'am, I have.
Okay. Could you tell me what motivated you to do that?
I felt like that no matter what happens to me, that if there are parts available, that they be used to help someone else, like cataracts for eyes, this sort of thing, a heart. I kind of doubt I smoke cigarettes, but I felt like if there's any part that could help somebody else, I would like to do that. Whether or not I personally, make any good deed influence anyone else in my lifetime, at least in death, there was one attempt made that I would like to leave to help someone else.
Tell me, how long have you been an organ donor?
Oh dear, been an organ donor since 1986. Every driver's license I've had, I've marked on it to organ donation. Also, I have given blood a couple of times. The last time I stopped giving blood because I was the one that got sick, and it kind of startled me. It wasn't anything major. It just startled me, and I said, well, I think you need a better lifestyle so you can give blood. And since you're not going to change your lifestyle, that we won't do. But I have been an organ donor for about the past over 16 years or so.
Tell me, when you found out that this was something that you could do, meaning donate your organs, did you just readily jump into it, or did you require some thought?
I jumped into it, but I've already had knowledge of what good it does. For example, there was a book several years ago, Who Gets to Play God? It was published, it was about some organ committee of those people who were allowed to be on dialysis units. This is about 25, 30 years ago. And I felt like, well, gee, if you can just donate a kidney, we wouldn't have this problem of who gets to wait for the dialysis and who gets to see God the hard way. So I felt like, well, if organ donation would help, I got a good kidney, I work them out every day, yes.
Thank you very much.
You're welcome.
Yeah, Mr. Nesbitt, yeah. Could I get you to
Oh, yes.
sign
You want
a
me to
release
release
for
this?
us, please?
Yes.
So we can be legal.
time anybody ever really asked me about organ donation. I always thought it was a good thing, you know. And I remember why I always did it. Because I felt like, well, like, hey, right now, by myself, so I'm not a major influence on anybody's life. I felt like this is one thing I know I could do. Okay.
Blyford.
Yes, ma'am.
All right.
Goes back to Old English. My mother said it means a happy voyage.
Well, you're the first Blyford I've ever met in my life.
Well, if I ever become successful, it won't be the last time you see me.
All right. And what do you plan to become successful doing?
I have a fantasy of doing two, three things. One, I would really love to be the guy to build a HAL 9000 computer. If you ever remember the movie 2001, I want to build that. That's what got me into electronics. And I work on computer equipment now. And I also would like to become a historian. I love history. My favorite professional historians are Barbara Tuchman, and the guy who started it all was Edward Gibbon, who wrote The Decline and Fall of the Roman Empire. And since I like history, I figure if I could study what's in the past, I have an idea of where we're going in the future. And if I could come up with a good idea, say, hey, maybe we could go this way because the Romans tried it and it worked. In fact, classic example, the battle plan that was drawn up for the final conquest of Kuwait, put together by Colin Powell, was based on a plan used by another black man, Hannibal, against the General Pyrrhus 2,500 years ago in Rome.
You know your history.
Yes, ma'am.
Tell me this, what do you see as the ultimate spinning into the future with regard to organ transplant? What do you see as the ideal situation if you could create that? Where do you see organ transplants going?
That ethically, this is dangerous, but I would like to see more research done with stem cells in which we could actually grow various parts and be able to place them in the people without the fear of rejection or infection, this sort of thing. I think this is the most natural and economical way to go rather than even using animals. There is still a possibility that animal parts can be rejected. In fact, there's been one experiment made here recently where a pig's liver, was used until an operation could be performed for a donation of a real liver to a young boy. And they're still studying that to see how that is working out. So far, there's been no problems. But I'd rather that, if nothing else, we kept it in species. But we'd have to go over the legal and ethical concepts and controls with which, some people might not want to buy themselves new parts like brand new eyes, or say maybe I'd like to have naturally implanted breasts, which I think is not necessary or warranted along those conditions. That's how I like to see the future in organ transplants.
Thank you. I considered you a futurist. That's the reason I asked you that question. Thank you very much.
You're welcome, ma'am.
I'll look for your name.
Okay, you'll find it.
Opinion. Can we get that opinion?
No.
Oh, okay.
But anyway, see, we're given only one body. And we're responsible to take care of that body as long as we have it. But if people screw their own bodies up, why should another person be eligible to put them on that deal to save them? Let them go to the Undertaker body. That's all I have to say.
Thank you.
Ready?
Tell me your student.
Sure. Excuse me. Hi. My name's Jeff. I'm an art student, and I'm making a documentary. We're asking people their opinions about organ transplants. Just wondering if you'd like to give your opinion one way or the other.
Organ transplant.
Would you?
Yeah. It's It's a useful invention. I mean, organ transplant like kidneys or what? Like liver and stuff?
All of it.
Heart? Yeah, but from what? From donors? From the donors that volunteer for it before they die, you know? Yeah. That's a good idea.
Are you a registered donor?
No, I'm not. But I'm thinking about it. Yeah. That's a good idea. Like eyes on what have you. Ears, I haven't heard of it, but yeah, internal organs. Yeah, no. Liver, heart especially, right? Is not what most people die of, heart attack or faulty heart valve and stuff like that. Yeah. Well, I read about it in the paper all the time, so does everybody. It's just too bad some people, they have to wait on no donor, or that type of blood cannot be located. See? Like that baseball player, what was his name, Mickey Mantle? Yeah. I mean, they found one very quick for him, did they? So, that's all I gotta say about it. You know. I'm thinking about it. Yeah.
Thank you very much.
You're making a documentary, yeah?
Yes. Could we have you sign a release to give us permission to use your comments?
Yeah, it's just confidential. Just got to show that I got everybody's permission to do it.
Yeah, I have a pen for you.
Hey, there goes the ducky. Right here.
Yes. Do you want to put your address here?
I got a post office, Doc.
That's fine.
That'll do.
No, I don't have no.
Okay. Thank you very much, Mr. Rice.
Okay.
Thank you. Yes.
Appreciate your time. Have a good weekend.
Yeah. Yes, sir.
Oh, this is a family one. Yeah. Yeah, you're good with you. Look more like a student than us.
Excuse me. Hi, my name is Jeff, and I'm an art student down at the Art Institute. And I'm making a documentary about organ transplants. Just asking people their
We're not
opinions
interested in
about it.
documentaries. Thank you very much.
All right.
Thank you. Good luck.
Thanks a lot. How you doing? My name is Jeff. I'm a student filmmaker, and I'm making a documentary about organ donation or organ transplants. Wondering if you'd like to give me your opinion on the camera, either way, how you feel about it. Would that be cool? All right, thanks a lot, man.
Okay, I'm going to ask you to give me your full name first, please. Let me know when you're ready.
Okay, I got speed. Stand by.
Okay.
And hold the mic a little low so we don't pick up the highway so much.
How's that?
Even lower. Even lower would be good.
Okay.
That's great.
Okay, could you give me your full name, please, sir?
Dan Van Horn.
Okay. Mr. Van Horn, are you a registered organ donor?
Yes.
Could you tell me what motivated you to become an organ donor?
That's the right thing to do.
How do you feel about organ transplants?
I think it's a good thing. Yeah.
Did it take you a long time to make the decision to become a registered donor?
No. No.
How long have you been one?
For about 15 years, I guess.
So as soon as you heard about it, you did it?
Yeah. Yeah.
How do you feel about becoming an organ, a recipient of someone else's organ?
Well, if I needed it, I guess I wouldn't hesitate. Yeah, I mean, if it was the opportunity was there, sure.
Okay. Thank you very much. Can I get you to sign a release for us, please? If you're homeless, how will they become aware that you are a donor?
On my license.
You have your driver's license? Okay, good. Thank you very much. Yeah.
Have a good day.
About it, would you be willing to go on camera and give us that?
Yeah.
Okay.
Sure.
And again, get on that side of them and keep the mic between you and the highway.
Okay.
Yeah, because you got to buffer the sound as much as possible. It's
Yeah.
kind of hard to do on here.
A little bit in here, like so. Yeah, that's good.
Okay.
Okay.
I'm going to ask you to give me your full name.
Okay. My full name?
Yeah.
Leslie Joe Pritchard.
Okay. Are you ready?
Yeah.
Okay. Good afternoon. May I have your name, please?
Leslie Joe Pritchard.
Okay. Mr. Pritchard, are you a registered organ donor?
Yes, I am, on my driver's license.
How long have you been a donor?
Since I came back to the States 10 years ago.
And what led to your making the decision to become a donor?
Well, if I'm done with the parts, why shouldn't somebody else use them? And there's a John Prine song that, I don't know if you ever heard of it or not. Please don't bury me down in that cold, cold ground. I'd rather have them chop me up and pass me all around. Throw my brains in a hurricane, the blind can have my eyes, the deaf can have both my ears if they don't mind the size. So what the heck, why not? I've had good fun with them. They might work for somebody else. They probably don't want the eyes, but some of the parts are still pretty good.
How do you feel about becoming a recipient of someone else's organ?
I don't see anything wrong with it. I mean, if it's a part, it works. Basically the human body's a machine, just more complex than what we can actually make at this point, but they've made great strides already. They can make some organs. They're working on making complete intact organs so that you no longer have to wait and be on a list. Eventually you'll just be able to get the part that you need when you need, made actually from yourself. So it's something that's going to happen in time. People need to get used to it. I have had at least one acquaintance of mine that died because of religious reasons. He could have survived had he simply got a blood transfusion. And that was a real shame to see somebody that much ability, talent, and everything die because his religion said, no, you can't do that. And that was the only reason. Science was able to do it, capable, and willing. But it was a real shame to see somebody die just because someone had said that this is not something that God wanted. I mean, I don't think really people know what God wants. If they did, we'd probably be a lot better off.
Thank you very much.
You're welcome.
Yeah. Can I get you to sign this release for us, please?
Sure. Were you guys down at the market earlier?
No.
That was somebody else.
Oh yeah? Someone else?
Oh, that's right. No, they were down there with an audio, but they weren't. Yeah, it was like NPR's radio.
Oh, okay.
Okay.
Because they were tagging along behind me and a tour group about 2 hours ago.
Well, I guess today is the day for this sort of thing. Here, let me hold this.
That's okay.
I like that song.
Yeah, that's a good one. Today's what, 10th or 9th?
This
Very
can help our careers.
That's right.
We're like models. We've never been on TV though.
I'm going to IMTA in LA. I can be an actress.
I'm going over there.
Thank you very
You're welcome.
much. Yeah,
Take
we
care
really
and good luck.
appreciate it. Thank you.
Thanks a lot. Okay, why don't you come around a little bit this way?
Hey, you first. I'm not going.
Yeah, for the two
Oh my god.
You're just going want to do the audio on this, right?
Well, yeah, well, I'll shoot, but...
I don't know what I want to say. I don't really want to be on.
I do. I only have to say something like really small.
All right. Okay. Why don't you come up? Okay.
What do I say? You can like edit some of it out if I mess up, right?
Yeah. Okay. Give me your full name, please.
Sarah Bonbreak.
Okay. Sarah, could you give me, are you a registered organ donor?
No, I'm too young.
Okay. Would you become one if you could?
Yes, I would.
And why would you make that kind of decision?
Because you can save someone's life. And yeah.
Well, does your family know that you would like to become an organ donor?
Yeah, when my dad died, my mom had his organs donated. And so that saved like a lot of people's lives.
How did you feel about your father having his organs donated?
I felt good about it because I knew that even though he's dead, he's like helping other people live.
Was he a registered organ donor, or did your mother make the decision on her own?
I think my mother made the decision.
And how do you feel about becoming, if you could, to become someone who received an organ transplant?
I would be so grateful that someone would actually take something out of their own body to give it to me, save my life. All right.
Thank you very much.
You're welcome.
Hang on 1 second. We need to be able to get you to sign a release, but if you have a parent or guardian who can sign off on it too.
She's not here. Is that
She's
bad?
not here.
I'll pretend to be your guardian.
If you give us your phone number or something, and we can track you later to call if we want to use it. That was pretty good.
Really?
Yeah.
We could just stick with the audio.
Okay.
Yeah.
Either way.
Yeah, we'll just use a voice. Yeah.
But if you want, I just thought that since someone in the family, that might be a good one to
Yeah.
use.
Yeah.
If you want, legally we have to get signature of a parent or guardian to use your picture. So that's your call.
Let's see. Who are you guys with?
Well, we're an independent production company. I'm a student filmmaker, and this
All right.
is kind of
What production company would that be?
Well, my production company is called Burger World.
And we call this WW Productions.
WW Productions. I don't know.
I think we better stick with the audio on this one.
Okay.
It was good, but yeah, thanks. That
All
was
right.
really
Thank
fun.
you.
Thanks a
Thank you
lot.
very much. Yeah.
Oh, we're going this way. Thanks a lot.
Yeah, we got just